couple of times I've nearly gone.
Phil Williams needs a hip replacement so badly he's struggling to walk. But during the pandemic, his operation was cancelled twice, and he currently has no new date for surgery.
If you look at the state of my mobility, you think that's difficult. Imagine what it's like when I'm trying to support my wife who's a paraplegic in a wheelchair.
For his wife Kath, who he cares for, the wait is agony too.
Kath, tell me, what is the hardest thing for you?
Watching him suffer. Hearing him crying out when he takes a step and the bones catch.
NHS waiting lists are now the longest since records began. Even the Health Secretary admits things are going to get worse before they get better.
Do you feel daunted by the scale of the challenge?
Of course it is daunting. The work that we've done that suggests that waiting lists will grow, sadly, before they get better. And the reason for that, by the way, is because we estimate there's some 7 million people that in normal times would have come forward for help from the NHS, but they didn't. But now we want those people to come to the NHS.
What do you say to those people who are in pain, whose lives are really being blighted by this?
I would say that I understand, and I am doing, and this government is doing everything it can to increase the capacity, the ability of the NHS.
The problem is not confined to England either. In Belfast, LEESA HARKER needed an appointment to see a rheumatologist.
So the letter says it'll be 6 years for an initial consultation appointment, and it also says that this is not expected to change in the near future.
Nobody should be waiting 6 years to find out, what it is when it takes a couple of minutes to examine someone.
Many hospital trusts are innovating to try to reduce their backlog. Here in Croydon, they've created a hospital within a hospital, a ring-fenced COVID-free zone that's helped their elective surgery go from standstill to 120%. NHS leaders say significant extra money will also be required.
The suggestion is it's probably somewhere between £2 and £3 billion a year for each of the next 2 or 3 years. So we are all looking at the spending review that is due in November, December, to see is that money forthcoming.
Meanwhile, there are millions in the same position as Phil who don't know when their wait will end.
When I get woken up at night with a pain, I'm led there in bed thinking about and worrying about. It's scary times. Scary.